pain is a bit sharp.
Sharp, okay. Is it mostly localized to your lower back, or does it go up towards your back of the neck here?
Yes, it goes up through my spine, all the way up. But I feel like most of the pressure is on my lower back.
So mostly lower back impacted with slight spinal impact. Do you get any headaches when you feel this pain?
Occasionally, yes.
Any joint pains?
Not at the moment.
Any redness? Have you noticed anything abnormal with your skin?
No.
Have you had any recent injuries?
No.
Are you on any new medication?
No.
All right. And last time I did notice that you have a slightly lower blood pressure. Have you been dizzy at all since I last saw you?
No, I've been better.
Okay, good. Any difficulty breathing? You mentioned that last time.
Yeah, it still happened for about the first week, but then it cleared up. I mean, I feel a lot better.
Okay, good. All right, so let's go ahead and check out your cranial nerves first. Since, any abnormal, especially sharp shooting pain anywhere in your back could be an indication of maybe potential nerve damage. So I do want to make sure that neurologically you are okay, as well as physiologically. So I'm going to go ahead and put my gloves on. Do you feel any pain right now?
No.
Okay.
Oh, just a little bit.
Okay.
But it's not as prominent.
Any sharp shooting pain though, or is it just a discomfort?
It's more of a discomfort right now, but I know the sharp pain will be coming soon. It comes and goes.
And have you noticed you doing anything in particular when the pain arises?
No.
So not doing exercise.
Yeah, true. I'm not really being that mobile, so I guess I'm not really using the muscles.
Okay. So I'm going to go ahead and start by checking your vital signs first. And let's check your temperature. This is going to go over your forehead. .7. That's all good. Let's check your levels of oxygenation in your blood. So may I please have your index finger? Okay, just snatch that right there. And just relax your arm and breathe normally. Now check your pulse. Okay, and over your brachial artery. Okay, good. Choroided as well. Alright. So we have 99% oxygenation and 75 beats per minute for your heart. So that's all normal. Make a note of that. Okay. Go ahead and listen to your heart and your lungs. Last time I was able to hear a little bit of a hissing over your lungs area. So let's see if that all cleared out.
Mm-hmm.
Okay. Is it okay if I touch you with my stethoscope?
Yes.
Okay, I can just go ahead and relax. Take a deep breath in. Okay, and just relax now. I'm looking for any murmurs, anything abnormal with your ventricular muscle. Okay. Steady rhythm to your heart, not hyperdynamic. Okay. Take a deep breath in and out. Okay. Yeah, so lungs cleared up just wonderfully. With the antibiotics, I'm not able to hear any of those, the wheezing that I heard last time. All right, let's go ahead and check out your eyes first. So you can look into the distance, checking for the pupil response. Good, perfect. And now look up for me. I'm gonna take a peek at the bottom, the base of the eyes. Good. Conjunctiva is pink and moist, clear eye is white. Iris and cornea look okay from this position. So I'm gonna go ahead and just feel your head and your lymph nodes to note any potential enlargements, any masses, anything abnormal. Okay. Any pain when I press down on the masted bone process? Okay, good. So that ear infection really did clear out. I'm going to check your thyroid as well. Okay, can you look up and swallow? Okay, perfect. Okay, and now do that one more time. Perfect. So thyroid gland moves up and down, barely palpable. Okay. Checking your lymph nodes. Cervical lymph nodes, occipital. Preauricular, posterior auricular, tonsillar, submandibular and submental. Okay, right there. Good. No lymph node enlargement is noted. All right. Now I want you to look inside in my eyes and cover one eye. Okay, I'm going to mirror you. And now I'm going to bring my fingers in the field of vision, and I want you to say now when you start seeing them. Okay? Okay, good.
No.
Good.
No.
Perfect. Now let's cover the other eye.
No. No. No.
Perfect. Okay, and now I want you to just follow this light. Try to keep your head steady, so just use your eyes, not your neck. Okay, good. And I'm going to bring it closer and further away. And one more time. Good. And take it out. Good. So good eye mobility. Peripheral vision is intact. I'm not noting any abnormalities. There's no discoloration of popped blood vessels, no redness. Have you noticed any more, discharge in your eyes after you started the antibiotics? No, so okay, so that went away too. Any problems with your nose or your mouth? Sense of smell or sense of taste? No, good. Okay, I'm going to just feel your nose. Okay, so I'm feeling a little bit of a deviated septum. Have you ever been diagnosed with that? No, okay. Do you snore at night?
I don't think so.
Okay. So it may just be very minimal, slight deviation. So I'm going to take a look inside. Can you look up for me? Good. Good. No obstructions are noted, which is good. Any problems with your hearing the last couple of days? Any tinnitus, abnormal sounds, or anything?
No.
Good. Now I want you to close your eyes and tell me if you hear a sound with your left ear or with your right one.
Left. Right? Both?
Yes, that was a trick question. Okay, very good. So next up I'm going to check your dermatomes. So dermatomes are areas of your skin that are innervated by the same spinal nerve root. So any abnormalities with particular areas of your skin could be indicative of neurological disorders. So I'm going to go ahead and test them. All right, then we're going to begin with a test called sharp or dull. So I have here a sharp object and a dull one. So I want you to close your eyes and say sharp or dull. Okay, and I'll be touching you on important areas of the skin that are innervated by the same nerve.
Dull.
Okay, good. Very good.
Dull.
Okay, good.
Dull.
Good.
Sharp. 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 Dull. Dull.
And now we're going to do the same on your face.
Sharp. Dull. Sharp.
Okay, good.
Dull. Sharp. Dull.
Good.
Sharp. Dull.
All right, very good. Now I'm going to touch you with something that's a little bit, sharper. And I'm going to place a little pressure on important meridians of your body. So I want you to just say yes when you feel it.
Yes. 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 Yes.
Okay.
Yes.
And checking your scalp as well.
Yes. Yes.
Good.
Yes. Yes.
Very good. Now I want you to close your eyes and tell me if you can feel this.
Yes.
This.
Yes. Yes.
Yes. And this.
Yes.
In both of your ears equally?
Yes.
All right. Your turn.
Yes. 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 Yes.
Okay. Was there any change in sensation between your left and your right arm? Any, feeling one more than the other?
No.
Okay. And how about here on your chest? Feeling them equally?
Yes.
Perfect. All right. So I'm gonna go ahead and check your reflexes next. So I'll be just tapping you. You can close your eyes and just relax. Good. So good ocular reflex there. Perfect. Good. And if you can open your mouth slightly, perfect. Good reflex, all right. Good. Perfect. Good. Can you uncross your legs?
Yeah.
Good. Perfect. Okay. And do you feel this?
Yes.
Good. And that?
Yes. Yes.
Okay. Now I'm going to touch with something cold. And I'm going to continue touching you. So it's going to be a continuous sensation. And I want you to say when you stop feeling it.
Yeah.
Okay, good.
Yeah. Yeah. Yeah.
Okay, good.
Yeah. Yeah. Yeah.
Good.
Yeah. Yeah.
Good. Okay, Alessandra. Now I'm going to test the myotomes. So I'm going to be pushing on several areas of your body, and I want you to resist that push. So starting from your head. Good. Your shoulders. Good. Your arms. Good. Your chest. Good. Your chin. Good. And can you push into my arms with your knees? Good. And your tummy back. Good. Perfect. So good muscle mobility there and good resistance. Now I'm going to take a look at your back. So all right, Alessandra, are you nice and comfy? Just going to make sure the hair is not in the way here. Okay. And I'll begin the back assessment by doing a visual inspection of the skin on your back. Lower back looks fine. No signs of any dermatitis. Okay, good. No blue or gray colors. No redness. Your arms look fine too. Checking your scalp for any redness. Any folliculitis. Good. That all looks normal. So I'm gonna go ahead and just feel your spine. Starting with the cervical spine, just palpate. Checking each vertebrae for any nodules. Okay. No nodularity is present. The spine is straight. Okay, I'm going to palpate the lower back muscles. Not feeling any tensions. And supraspinatus, deltoid, and the scapula here in the back, where the shoulder blades meet. Okay, good. I'm gonna go ahead and listen to. I'm gonna go ahead and percuss. A little bit of an increased dullness on the right lower quadrant. Yeah, there's not as much dullness on the left side. So definitely a little bit of a lack of symmetry here in the resonant sound. Go ahead and measure. 30. Just checking the proportions of your back. 57, 57, 40, 60. Okay, that looks good. Let's check the sensitivity of your spine. Did you feel that?
Mm.
And that?
Mm.
Okay. And that? That. Good. Now I want you to tell me when you stop feeling that sensation.
Yeah.
Good. Good.
Yeah.
Good. And now let's check the spine for sensitivity to vibration. feel that?
Mm.
Good. That? Good. Good. Do you feel that?
Yes.
Good. That? Okay. That?
Yes.
And that?
Yes.
That? Good. Now I want you to tell me when you stop feeling that vibration.
No.
Good.
No.
Good.
No.
Good. Excellent. Okay, next up, I'm going to perform some light acupressure on your back and relieve the muscle tension, especially in the lower back area. Good. Do you feel this? Is that sharp? That's sharp. And this is?
Dull.
Dull. Okay. So go ahead and say sharp or dull.
Dull.
Okay.
Sharp. 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 Dull. Dull. Sharp. Dull. Sharp.
Good. Okay. Next up, I'm going to do some light cupping therapy to improve the circulation, stimulate the blood flow, and awaken the nerves in the back. top of your spine. Okay, Alessandra, this concludes the cranial nerve exam as well as the back assessment. I did a very thorough investigation of your back muscles, your spine. I checked the mobility. I checked for nodularity in between the vertebrae, so everything looks okay. I would recommend that you start moving around a little bit, so not be so much at bed rest. Okay. Try to walk, light walking, light jogging if you can. But other than that, yeah, everything looks okay.
Thank you.
Do you have any questions for me?
No, I don't.
Good. Great seeing you.
You too.